Hi, everybody. Welcome to today's edition of Health Hangouts with Amanda. The purpose of these videos, just in case you're joining us for the first time today, is to spread strength, hope, and love for those out there who are struggling, who are not asking for help, who don't know what to do. And I'm aware that we're all struggling in a variety of different ways. So I've put this video podcast together to reach out to a ton of people from different backgrounds, from different countries, and hopefully that something in some of these videos will speak to some of you. And so today we have Eva Bruce with us, and Eva comes to us all the way from, let me see if I can get it right, Brisbane, Queensland, Australia. Did I get it?
That's right. That's
I
right.
got it. I had to practice that. And Eva actually is the aunt of my partner. So Eva, I've never met you before. It's wonderful to make your acquaintance, and thank you so much for volunteering your time today. I think so right now it's just after 4 p.m. on, oh my gosh, what day is it today? Is it Thursday?
Yes.
Thursday. And what time is it there, and what day is it there?
It is just after 9 o'clock in the morning, Friday morning.
Wonderful. Oh, that's so cool. So you're just starting your day, and I'm just going to wind up mine. So, so Eva, if I can just hand it over to you to introduce yourself and tell us a little bit about what you do for work and anything that you want to share as an introduction.
I've not got a lot. I'm a clinical nurse, and I work for one of the major tertiary hospitals in Brisbane for a service known as Care Pact. We are a service that addresses all the acute care needs of residential aged care facility patients. We have a team that is based in every public hospital in our healthcare district that advises and assists around discharge planning and with the needs of the residents while they're in hospital. And I'm part of the mobile emergency team that goes out to the aged care facilities and delivers what we call an emergency episode of care. So all that entails is if there was an aged care resident that the facility was going to transfer to hospital and it was appropriate, and the GP, the family, the enduring power of attorney, and the resident themselves, if they had the capacity, were in acceptance, we would go out to the facility and deliver that care out there, because as you're probably aware, for this cohort of patients coming into an acute emergency department is not always in their best, not always in their best health for a start. The rates of dementia, delirium go up, and so do the falls risks and other knock-on effects.
Mm-hmm. Wow. And so I'm going to ask some questions about what you do in terms of the impact of being a nurse out there in Australia. But I'm also interested if you just share with our listeners just where you're from, because you have a different accent, and and how you ended up over in Australia, if you're whatever you're willing to share.
It was probably a lifetime journey. I grew up in rural Scotland, and you're bombarded with things like Skippy, the iconic Skippy, and bush education and the flying doctor service, and it all just resonated with me. But life goes on and life takes over, and your childhood dream becomes that might have been, and then life develops and you get windows of opportunity. And I had a window of opportunity in my mid-40s to be able to come, and as a family agreement, we agreed as a family that we would do that. So we made the necessary inquiries and went for it, and we've been here since 2006 now. My children are married, they've got children of their own and children coming, and yeah, I don't think we'll be going anywhere soon, certainly not during these times. Yeah.
Right. I was saying before before we hit record that I would love that we would love to come out there and visit, but who knows when we'll be able to travel again. But, and I've never been to Australia, so that would be really exciting to be able to do that someday. So you said, so you have some children and they have some children, and I believe you have a daughter has a child on the
On
way right now.
yeah.
And I'm curious, considering the restrictions and social distancing requirements, how it's going for you and your family system, especially considering you have a little grandbaby on the way.
I think to just take a step back a little bit, when we're put in a situation, any situation that impacts our sense of norm, our comfort zone, we have a decision to make. And this pandemic is another example of that. So when it hits, you're bombarded with the fear, you're bombarded with your normal day-to-day processes getting knocked out of whack, and you have to decide, and you're not alone. There's an acceptance, everybody in the world has been impacted by this at some form or another. So you're not the only person that's not allowed to see their grandchildren. You're not the only person that's got a daughter that's pregnant. You're not the only person that's work situation has had to go into pandemic mode. And then you adjust. So you deal with that initial onslaught, and then you look at the positives that come out of it. For example, in my daughter's case, she's been able to continue work up until 38 weeks. Now, would she have had the energy and the strength and the ability to keep doing that if she'd had to travel through a city to work every day? So in amongst all the things that aren't going right, what is going right? What is the benefits, which is a wrong word, probably benefits, but what is the positives is a better word that are within this. I can't give my grandchildren a cuddle, but I speak to them every night before bed. I didn't used to do that because I was seeing them, and that's been a nice bonus. So, and then the pandemic progresses. So you're hit with this initial onslaught of what you can't do, and gradually you become used to this new norm. Gradually it settles, and initially she didn't think anybody would get into the delivery room with her, but now she knows her husband is able to go into the delivery room with her. So am I explaining myself right? It's a continual adjustment on this new world we find ourselves in, and seeing what's good in it, so you don't get pulled down what you're missing. It's more of an appreciation of what you've actually got.
Absolutely. No, and I think that's a really important message, because a lot of folks are, from my experience in working with clients and just interactions with them having with people digitally, a lot of people are focusing on the negatives. They're looking at what they've lost. They're looking at what they can't do anymore. And so we say to them, like, let's look at the positives and what you can do within this. And especially as the depressive cycle continues, people get more and more entrenched in that, and it gets harder to come out of that. Yes. And so if we can share every day in this podcast and hear the same message as what you're saying, it's really important to put it out there and say, like, it is possible to see all the positives. It is possible to get through this. And we might have to be strategic about how we do that. But what I'm really hearing you say, Eva, is that it's about mindset. It's about what you choose to do with what's in front of you. Is that right?
Yes, but I think that we have that choice whether we're in a pandemic or not. And I think the pandemic makes the ability to do that sometimes harder, because we're getting bombarded by so many things. We don't have any resource or any previous ability or knowledge to be able to cope with. So I think within the world we're in, for people who are struggling, reach out, because we don't all have the same capacity, we don't all have the same support networks, and we don't have, but there is online stuff. There is an ability to access encouragement and positive messages and daily help through your podcast, for example. And I think that's what's important, is not thinking you're alone, not thinking you're the only one. Whatever situation you're in, there's probably somebody else out there in a similar or parallel situation that can identify with how hard it is for you.
Mm-hmm. And it certainly sounds like you're using the digital channels to be able to connect with your children and your grandchildren, and that seems to be going well for you.
I think it's the only way people, not just myself, but you, others out there, we are in, whilst we if you historically, when you think of pandemics, they haven't had these resources. So the isolation that historical figures might have felt, we've lessened it by the ability to utilise the IT world in which we live, and also the IT world in which to control this pandemic as well. We've just launched a COVID app for our phones over here, which, if you've been in contact with anybody that's COVID positive, you will get a notification on your phone to go for testing, just to try and control and curb the community spread. So that's another use of the IT world in which we live in.
I heard about that. I heard that they were going to release something, and by they, I don't know which country at the time I was reading about, but they have actually officially released that.
Yeah, I think within the first 24 hours, don't quote me, world out there, you can check on Australian COVID website, but I think there's about 2 million people approximately had signed up relatively soon after the launch. Yeah.
Wow. So I'm curious then, as we gravitate into you working as a nurse and the impact on, and I don't even know how to ask these questions because it's so different in Australia than what I'm aware of in terms of what's going on in Canada. Right. So if there's anything you could speak to of what you're seeing, so this app, that's great information. I didn't know that. And then beyond that. So, in terms of numbers, in terms of anything you want to share about the impact on your communities and the country.
Well, I think I said at the beginning, regardless of numbers, I think the feelings will parallel across the world. So I would hate to think that because our numbers are less, there wasn't the same, people didn't experience the same fear or worry or anxiety levels. But within the state of Queensland, we've only had 6 deaths to date, which I looked for British Columbia, I think you're over 100. So it puts it into perspective. For the whole of I'll just check my little notes here. For the whole of Australia, we've had under 8,000 cases. I think we've had 6,000, under 7,000 cases actually to date. So from a worldwide perspective, we haven't had the same onslaught, but we've had the same disruption to daily life. We've had the same fear, we've had the same anxiety. And within the client group I work in, the disruption has been huge. And the population that I care for is complicated by their age, by their comorbidities, and things like dementia, where they have their routine helps them in their day-to-day life. Their routine's been disrupted, so that has a knock-on effect to their behaviours, has a knock-on effect to the staff caring for them. And I think the staff have done an amazing job. I think the aged care world within my health district have done fantastically well. So big shout to them out there.
Absolutely. Can you speak to just the pressures of working in the field that you're working in now? You're actually the first nurse that I've spoken to in this podcast, or really at all. I've spoken to a few nurses who are either retired or on sick leave, but you're the first one that has been actively on the front line. So I'm interested in just what it's like to work on the front line.
I would hate to speak for any of the nurses out there because, as I say, the demand on them personally and professionally, because they don't just have normally at work, if you're in an emergency, because that's my background, you can have a really hard day. You could have an onslaught of physical and emotional trauma, but you go home and your life is normal. With this, you take it home with you. You're never off, because everybody's in this. Everybody's vulnerable. So you're working in an environment, and then you're going home to your family. Your children have maybe had to go to school because you're an essential worker. So it's much more complicated than being on a front line normally. That aside, I think the preparedness, I think the utilising the existing knowledge out there and has helped. And again, I think the frontline staff have been amazing. I think even little things like the doctors all had to shave their beards so that if they had to wear masks, the mask would fit right, and just those small things that would even make you smile, walking down the corridor and doing a double take on somebody that you'd seen yesterday with a beard, and suddenly today they've not got a beard. Wow, don't you look different? And those little things just help give you a little bit levity in a day that could be overburdened with a lot of increased anxiety. In my work, we're led by a medical director that was supremely prepared, and the knock-on effect on that have prepared us, and the delivery of care we give, I think, pretty well. We initiated, within our health service district, the majority of our nursing homes are independently and privately run. So we work in partnership with them. We can't tell them what to do. Their organisations will direct them accordingly, but we work in a supportive role and in a partnership with them. So we just, at the beginning of this, did a survey. How's your preparedness? Is there anything we can help you with? Do you need any extra information? And then from the feedback of that survey, then we went back and on a couple of occasions took the consultant with us to answer questions, just to address that fear, so that they can then take that knowledge and hand it down to their staff to address their fear and anxiety. We provided them with resources, simple things like a QR code, so they could access the primary healthcare network information, so they could access the public healthcare network system quickly, rather than trying to do it independently. We provided information that they might not have known who to approach for it otherwise, and generally, as I say, worked in a supportive role and in partnership with them to navigate the world in which we were in. There's no textbook on this because we've never lived it before, so it's, what do you need? Can we help with that? If not, where can we get you help with that? Things like PPE, where can you put in a request if you didn't have enough, or you might not have enough, where can you put in a request for that, so that they actually could assume some control in a situation where they might not otherwise have felt they had any control.
Mm-hmm. And do you find that the partnerships that you're trying to create with these independent companies, is that effective? Like, is everybody coming together and working together in this?
We work for Queensland Health, and the majority, or certainly a significant percentage of those residents, would otherwise be accessing a public Queensland Health hospital. And we've been doing this job for over 6 years now. So in the beginning, it's like any relationship, any partnership. It's about engagement, it's about building rapport, it's about building trust, it's about delivering what you say you're going to deliver, so you can build that trust. And over the years, we've developed what I would consider a really good working relationship. We have to respect and acknowledge they are independent organisations in their own right. However, if we could work with them, because the goal of this is ultimately is the best care at the right time in the right place for that patient or resident. And we're all working towards the same goal. So how can we work together as effectively as we can to get the best outcome for the patient? Because at the end of the day, that is why we're all here, and that is what we're all endeavouring to do. And then from the resident, you've got the families. It's nothing works in isolation. Everything's interconnected. So over time, I'd like to think for the majority of most, it's been successful. I can hardly, I can't really think of any situation that hasn't been beneficial to the resident.
That's wonderful to hear. I've heard and everything I say here is just something that I've heard somewhere. I can't prove it by any means, but I have heard or read some reports that in various countries, nurses will be, or frontline workers, they'll come home, but they don't go inside. They stay in a trailer that's parked on the driveway and things like that. So I'm wondering, in your case, are you having to be really strict on the parameters with which, like, you come back into the home and then you have things you need to do to take care of your family?
I think for me, it's easy. I live alone. So I just come in, I just drip everything off in the washing machine, in the shower, excuse me, and then carry on. And certainly for my co-workers, that's what they all do. But we're not emergency department per se. We're based off-site under the emergency directorate. So we aren't got the same exposure, or haven't had to date the same exposure as the emergency department staff. And certainly for the girls I know and the girls I work beside, I've got young families. That's what everybody does. They walk in, the strip, it goes in the washing machine, they go in the shower, and then they sit down and go, "Hello, darling, I'm home." Yeah.
Right. And so you mentioned a little bit earlier that, of course, things are, these are my words, but things are very different now being a frontline worker than they were in original, like kind of, I don't know if you want to call it normal circumstances or non-pandemic circumstances of being a frontline worker. And, my word also, but more complicated or more intricate. And so I'm wondering about self-care in terms of, I've talked to a lot of people who do work in emergency services generally without the pandemic, and it's a hard job. It's a high stress environment, and self-care is vitally important just under regular circumstances. So I wonder for you what your experience is of the changes in the circumstances because of the pandemic, and how you're working to take care of yourself in that.
I'm very fortunate in as much as the team I work with are very supportive, and we have time to debrief and at work, and we will go over things. And as this was getting rolled out, the plan, we were very clear about where we're going, why we were doing it, and what we had to do. And we haven't been hit by huge numbers. So personally, I don't feel my own mental health has had the onslaught that other healthcare workers will have had. I am aware of programs out there, like the ED doctors have a program which is called RAPM, and they have been doing things, and that's about wellness at work and mental health wellness. They also, from a workplace point of view in Q Health, in Queensland Health, if you are a vulnerable worker, you can ask to be deployed into a less acute setting if you choose, depending on your vulnerability, whether you've got a predisposition to anything respiratory, like if you've got chronic asthma, or if you've got an underlying heart condition, there is the opportunity for you to be utilised in a less frontline position. So there's various things as a health service they're doing to address the mental wellness, and then there's the personal approach as well. And I do, having been in healthcare many years, I do believe we are all accountable. We're all accountable for our own mental health, and depending on our capacity at any one time, we have to be able to access help for ourselves, whether that's through chatting with your mum, whether that's through having a drink over an online chat with friends, whether that's seeking professional help, or having a friend say to you, I really think you need to talk to somebody more than me. It would be nice to think that we could, if we required, have the courage to step out and get that help. Because with the best will in the world, lots of resources could be put in place, but if you don't actually step forward and take them, nobody can actually help you as effectively as they could if you ask for help. Does that make sense?
Mm-hmm. Oh no, that's wonderful. Yeah, I appreciate that. And I know that there's a possibility that there will be a lot of nurses that watch this video. And so I think it's very important what you've said, you know, and it's not just nurses, but anybody who can see that there are resources available,
Yes.
a lot of free resources available.
Yes.
And if you're not accessing them, then nobody can help. Right.
Yes.
And it's a really important piece. We have had some nurses contact us for counseling support and kind of emergency support. We do offer also an emergency support group we've been doing for a number of weeks now, and it seems to be helpful. And so, but it's interesting because the last emergency support group that we ran, there was a theme in the group of I didn't want to come today.
Yes.
Like I really just wanted to engage in whatever I think is going to make me feel better in that moment, and I didn't want to be here. But they did come to the group. The group was cohesive and connected, and at the end of the group, there was a unanimous, I'm glad that I came today. So it's very common that when we're struggling, that we just don't want to do things and we don't want to step into it, right? But what we might not realize is when we do step into it and we just allow our feelings without trying to change them, then we can have a positive experience and walk away thinking, wow, like I'm really glad I did that.
Yeah.
Right.
I think it's that old adage, the first step is always the hardest. And it's breaking that, well, I've never had to do this before. I'll be all right, but you've never lived in a pandemic before. So, and are you all right? Ask yourself, are you all right? Or is your anxiety, and are you in a heightened state? You know, are you not able to eat? Are you, on edge? And then if this isn't your norm, then what can I do to help myself and seek the appropriate help? Yeah.
Mm-hmm. Absolutely. And I'm just thinking, do you have any other advice for nurses, especially the ones in emergency services or the ones working on COVID units, that you could speak to, if you could say anything to them to support them or help them support themselves other than what you have already said?
Oh, that's a tricky one. I wouldn't like to tell anybody because the personalities and individuality out there, but if I had to say something, I'd probably say be honest with yourself. Really be aware of where you are, what you're feeling, and take that first step if you need to take it. Ask for help. Or if somebody says to you, are you all right? Don't flippantly say to them back, I'm all right. Be honest and say, actually, I'm not. Because like we've just said, if you don't admit it, nobody can help you. And it's not, admit's like got negative connotations. It's just like, I want to function the best I could function in my profession. So what do I need to do to be able to do that? I need to get somebody to support me in such and such a way. So it's not an admission of failure. It's I'd like to do better, I'd like to be stronger, I'd like to be less anxious. What do I need to access to help me be that way?
Mm-hmm. I think that word failure is such a dangerous place to go, right? Like, and in years past, I struggled a lot with that word and really kind of taking it in and allowing it to kind of eat away at my insides. And now I think, yeah, I love that you've just said that, because it's not about a failure. It's about saying, how can I be stronger?
Yes.
Or how can I achieve these goals that I want to achieve that I'm not able to achieve by myself?
Yes.
It's about humility in being able to say, I can't do this by myself.
And that's what I meant when I said be honest with yourself. It's the humility to acknowledge the strengths you've got, but also the other aspects of what's going on within you that are holding you back from being or achieving what you'd like to achieve. Yeah.
Mm-hmm. And isn't it true too, Eva, that and thinking about the human condition, in that we often don't realize what our strengths are much of the time until we can step in and challenge ourselves in various ways and see, like, wow, like I can do this. A simple example is doing these videos. I'll speak for myself, but when I thought of starting this, I had not, I released one video online prior to starting this, and I hated it. I just critiqued myself, and since then I've done maybe 30-ish videos, and I still get nervous every time I go to record. But what I've realized is just stepping into the discomfort and going, okay, how can I strengthen this? How can I be brave in this? How can I, challenge my core beliefs of whatever they are, and stepping into it and doing it, although I still get nervous. Here we are.
Here we are.
Here we are.
Yeah, I've never done one in my life before, and here I am. So all you guys out there, whatever you think you can't do, deep breath and just give it a go. And if it doesn't go the way, or anything doesn't go the way you think it should go, it's not a failure. It's that all these old things are old things for a reason. It's a learning experience. There's a great quote by I can't remember which professional tennis player it is, so I won't quote which one because I'll probably be wrong. And he said, it's amazing. The harder I practice, the luckier I get. And it's the same with life. You don't become an expert over life. You don't conquer the world just by setting out. You start by taking the first step. You don't become the best professional person you can be unless you do the work towards it. And it's like, yeah, you don't fail. You never fail. You just keep trying, really. Yeah.
And it just unfolds, and it's ever flowing, right? Like
a lot more eloquent. Yeah.
I think, I always say this: if someone 10 years ago, or even 5 years ago, even 2 years ago, someone said to me, this is what your life is going to look like in May of 2020, I guess it's April still. Is it April?
For you, May here.
Yeah. Yeah. At May there, right. This is what your life is going to look like. I would not have believed them. Like I would have been like, there's no way my life is going to look like that in 2 years or 10 years or whatever. So it just shows me that we're not in charge of what unfolds. We can be in charge of how we respond to what unfolds.
Definitely.
Right. And that's being able to accept our powerlessness.
Yes.
In whatever that might be. And there's certainly a lot of that's coming forward with this pandemic, on top of all the other things that we might be powerless within our lives. And so I think of I'm careful to introduce religion into the conversation, because I don't know, like, out there who's religious, who's not. So I'll say this generally, but you know, I believe in a universal force, and people can call that whatever they want, and there are all kinds of names for that. Just generally speaking, a universal force that moves the world and the way it's going to move, and my life and the way it's going to move, and something happens and I witness it. I'm just watching what's happening around me, and I go, okay, now I have some choices to make. If I go this way, this could potentially happen. If I go this way, this could potentially happen. But at the same time, I have no control over any of that. I can only control what I can choose. And then I really believe in accepting the consequences of our choices. And if we can do that, then we will feel, I speak to myself, if I can accept the consequences of the choices I've made, I feel stronger in my ability to move forward in my life, even if something that's happening in front of me is devastating, if that makes sense.
Yeah. Because
so go ahead.
You're living it now.
Living it now. Yeah. And it's very interesting to see how prior to the pandemic, in my life anyway, there was I'm an entrepreneur, and so there's a few businesses that I was/am running, and so I had a lot of business-based stress and decisions to make. And then the pandemic happened, and business changed, and it changed for a lot of people. Yes. And then it became more personal stress that wasn't business related. So it was, I'm going, oh wow, like I don't have to go to the office anymore. Not only do I not have to go to the office, I can't go to the office. Like it's just not something that people are doing right now. So now I'm at home and I have the ability to rest, but then I had all kinds of quite intense personal things that happened that created a lot of emotion. So and so on one hand, I'm thinking, man, like I work so hard every day, and then I finally get to rest, and then boom, these other things happen, and I'm not able to emotionally rest. But the way that I've changed the mindset of that, that seems to be working for me right now, is I was able to rest and actually face these other things that I didn't face before. So it's a gift in essence, because I imagine my life having to deal with all the business things that I was dealing with that were taking a massive amount of time, and then putting that on top of it. And, you know, that's breakdown central type stuff for me. So it was really a gift, and, you know, a universal force or whatever kind of navigated my life to look like this. It was a gift. And so, yes, lots of stress. And it seems to me that I'm coming into a place where I can start to heal from the personal stress. Yes. And the business stuff is kind of backburnered at this point in a lot of ways. But the personal stress is now, it's like drifting away, if you will. And I'm watching it and being a witnesser in everything that's happening around me, and I'm accepting what I cannot change. I'm doing my very best to do that. That doesn't mean that I don't cry at night. Sometimes I do cry myself to sleep, and I, you know, I won't speak for anybody else, but I wouldn't be surprised if I'm, you know, not the only one experiencing that for various reasons. And just like you said earlier, we have different scenarios, but we do have the same feelings. And when we experience those feelings, how we experience them, it's all very dynamic and different, but we're all sad for various reasons, and we're all happy for various reasons, and we're all struggling for various reasons. So I guess what I'm saying here is there's connection to be made in the quality of being human. We're just like, and we all have stuff to deal with, right? And so I love what you've said, Eva, in this conversation, in that, like, ask for help, because I certainly couldn't have done it by myself. I had a lot of support, and you know, I sit here and I run this counseling organization, but I'm no different than anybody else who has feelings and who lives and walks around or breathes, for that matter, right?
I think ask for it, but if you can't ask for it and somebody offers it, just accept it. Because sometimes you're crying out for it inside, but for for various reasons, like just your personality or your lifetime habits or whatever, a lot of people find it difficult to ask. But in this situation, there's, like I said earlier, there's an awful lot of help being offered. So if it's offered and you feel you need it, just accept, and the rest will fall into place.
Mm-hmm. Beautiful advice, and I really appreciate how you just discern really well when it comes to not speaking for other people, and you respect that everyone has different personalities and different circumstances, and you've said that a few times in this interview, and I respect that greatly, that you're not being presumptuous in any way of how people are feeling, or like you've really delivered a beautiful message in a generalized way that I hope the masses can hear.
Oh, thank you.
Yeah, yeah. So, so I believe that this maybe is a natural place to close this conversation. Is there anything else that you would like to say before we do that?
Thank you for giving me this opportunity, because like we've said, wow, this is a first. All you people out there, always time for a first, however old you get. And just an encouragement that look for something positive every day, and it might just help you keep on. There's a saying in Australia that's very rife, and it's just, well, what do? I'll just keep on keeping on. And without that, can be glib, but I don't want it to be glib. I think how you have to ask yourself, how do I keep on keeping on? And look for something positive, take help, and just try and be, in a professional world, the best professional you can be in these circumstances, because this will go down in history. There will be children being born, yeah, I was born in COVID year. There'll be children leaving high school going, never got my end of year schooling, that was COVID. There'll be lots of things historically. Look back on this. How do you want your COVID year to look? What do you want personally to be able to look back on and say, and then finish the sentence? Yeah.
Mm-hmm. Yeah, wonderful. Well, just as much as you're expressing thanks, I too will express thanks for again just donating your time, and personally, it was really wonderful to meet you. I've heard great things about you and know other members of your family, and so it's really cool to do this in this capacity as our first visit, and I'm excited for the day where we can fly down there and actually spend a few weeks and spend some time with you and your loved ones.
Thank you. Lovely to see you.
Sure.
Take care, look after each other, look after my niece, and yeah, and to all you people out there, keep well. Take care.
All right. Thank you so much, Eva. Bye-bye.
Bye. Bye.